Hi everyone, my name is Tony Wang and I'm a student at the Georgia Institute of Technology. Today, I'll be presenting metrics for peer counseling, triangulating success outcomes for online therapy platforms. An increasing number of people are using the internet to seek mental health support. The platforms people use are diverse, ranging from specialized therapy platforms to popular social media. One of the key traits defining these online mental health platforms is that much of the labor providing support is done by peers, untrained volunteers who give time and energy to help others. Online peer counseling has been found to have a variety of positive outcomes. However, to the best of our knowledge, no prior work has aimed to holistically triangulate multiple outcomes at the same time. Different metrics might point in different directions for complex social environments. This leads to two questions that guided our project. First, does triangulating across multiple outcomes provide novel insights for finding counseling success indicators? And second, do widely used predictor variables of counseling success track multiple outcomes consistently? To answer these questions, we created a framework for online peer counseling outcomes using a literature review. Then we modeled the relationship between previously reported linguistic predictors of effective counseling with 4 different outcomes using data from 7 Cups of Tea, an online therapy platform. We found 3 outcome levels reflecting different variances in measurement in the literature. Community level outcomes track behaviors or attitudes spanning interactions with a broader group of users. Conversation level outcomes track perceptions towards support provided by others. Individual level outcomes track the impact of receiving support on a support seeker's cognitive state. We also distinguish between 3 methods of measure in our framework. Attitudinal measures capture an individual's beliefs about themselves or others. Behavioral measures are found in logging data based on interactions on a platform. And annotated measures are those in which external human judgment is used to provide data for modeling. Grouping prior reported outcomes by construct level and method of measure allows us to compare different types of outcomes for online mental health platforms. And using our framework, we selected 4 outcome measures to evaluate using 7 Cups data. These were mood, rating, and engagement. We chose 1 outcome at each construct level, but we also used 2 methods of measure for conversation level outcomes. This allowed us to examine how within-level constructs might triangulate together. Before continuing, I want to discuss the context of our research. We partnered with 7 Cups of Tea, a coping and therapy platform that allows private one-on-one conversations between peers. 7 Cups supports more than 1 million users worldwide each month, and users can register as a support seeker, called a member, or a support provider, called a listener. New listeners are given brief training before they are allowed to chat with members. For brevity, I will refer to those seeking support as members and those providing support as listeners in the context of 7 Cups. Using 2 years of conversation data, we identified bursts of activity inside conversations following a method by Kushner and Sharma. We split conversations into multiple sessions if 2 bursts are separated by 5 days or more. Only the first session between each member-listener pair was used in the analysis to reduce the influence of prior sessions on later sessions. Furthermore, we removed short conversations with less than 20 messages to ensure we were modeling conversations that had not ended prematurely. After data cleaning, we ended up with over 1.7 million sessions in total. Next comes the step of operationalizing our outcome variables. First, we call community engagement retention and assign a binary value of 1 if a member appears again in our dataset to have a chat with a different listener and a value of 0 otherwise. Second, we call conversational engagement follow-up and assign a binary value of 1 if a member has a follow-up session with the same listener and a value of 0 otherwise. Third, we use a 1 to 5 rating that members can leave for listeners on the 7 Cups platform. Fourth, we use a mood score currently administered on 7 Cups. The platform asks members, "How are you feeling right now?" to which they can respond with a 1 to 5 score. Let's take a look at our outcome distributions. The top graph shows that 90% of sessions result in retention, and the bottom graph shows that 8% of sessions result in follow-up. In general, most members remain on the platform, and few continue chatting with the same supporter after a 5-day idle period. For ordinal data, the top right graph shows a J-shaped distribution for rating, with much of the scores accumulating at a 5. The bottom right graph shows, for post-session mood, that the majority of scores are neutral or below. We use 7 predictor variables from prior work modeling attributes of successful peer counseling conversations. These predictors include the total number of words, the number of member words to the total words ratio, the amount of self-disclosure provided by both parties, the listener's median response time, the amount of linguistic style matching, and the amount of topic matching. The hypothesized impact of each variable is noted in parentheses. A plus sign suggests that more of the predictor should lead to better conversations, while a minus sign suggests the opposite. A variety of control variables were also used to control for variation in individual life experiences and the range of content that appears in conversation. With 4 outcomes, we used 3 different regression models. For retention and follow-up, we had no missing labels, and we used logistic regression. Ratings and mood had missing labels, so we had to treat these a bit differently. For ratings, we used the Heckin selection model, a 2-step model which estimates a Gaussian distribution based on observed data, and then the Gaussian distribution is used in linear regression over the entire dataset. This model eliminates the need to drop sessions that did not have a rating score. For mood, we had a small sample relative to the total number of sessions, which may lead to poor Heckman selection model estimates. We removed sessions with missing data and model using 4,839 sessions that had pre-session and post-session mood reported. For the mood model, pre-session mood was used as an additional control variable. Next, let's dive into the results of our 4 models. Retention shows negative correlation with the reported predictors of effective counseling, except with median response time and topic matching. Follow-up shows a more varied relationship across predictors. It has a positive correlation with total number of words, listener self-disclosure, and median response time. On the other hand, it has a negative relationship with other variables. Rating is the most consistent outcome in relation to prior literature on predictors of effective counseling. Only 2 predictors, member words ratio and median response time, show relationships opposite to what was hypothesized. Contrary to rating, an increased likelihood of follow-up is associated with less member self-disclosure and linguistic style matching. I'll speak more to an interpretation of this difference later. Lastly, mood shows little interaction with predictor variables, except for a positive relationship between total words and member words ratio. Overall, these results show that the relationship between outcomes differs across construct level and method of measure, suggesting that nuances in measurement drastically impact interpretation. Speaking a bit to the significance of these findings, we found that predictors of effective counseling correlate negatively with platform retention. This aligns with prior work that has suggested that users drop off a platform if their needs have been met. Conversation level outcomes were mostly consistent except for 2 predictors, member self-disclosure and linguistic style matching. Higher amounts of seeker self-disclosure suggest that a seeker has opened up in a conversation, and higher linguistic style matching represents increased alignment in a conversation, something that might happen when a seeker and supporter reach agreement. Based on these differences, a novel insight is that some conversations have an idle period, yet may continue if members are not given the opportunity to speak about their problems. Combined, high ratings and low follow-ups may signal effective single-session counseling on 7 cups. Lastly, mood shows little relationship with prior predictors except for total words and member word ratio. This may suggest that the more members talk about their thoughts, the more likely their mood is to change overall. Based on our findings, we provide further suggestions for online mental health platforms regarding positive outcomes. We first suggest that outcomes should be considered within a single-session framework. Single-session therapy is an on-demand therapy delivery method in which the aim is to maximize the efficacy of the first and sometimes only session with a walk-in therapist. Such a delivery method arises naturally in 7 cups, and outcomes have meaning when interpreted with this lens. For example, follow-up was operationalized as a variable representing engagement, a generally positive outcome in the literature. Follow-up with a listener on 7 cups, though, may not necessarily be a positive outcome, but instead a sign of needs being unmet in the first single session. Retention rating and follow-up have meaningful interpretations within the context of 7 cups, but it remains unclear if mood generalizes as well as an outcome metric. This may be due to 7 cups being an open platform for discussing a range of topics. More work can be done on determining the best context for leveraging mood and other individual level metrics. Our results also suggest room to grow in terms of novel online therapy platform metrics. For example, little is known about long-term versus short-term illness needs. Future studies can examine if outcomes track differently for chronic versus acute illness support. Lastly, prior research on peer counseling online has tended to focus on measuring seeker outcomes without addressing other desirable measures of dyadic interaction. If peer counselors on platforms can be trained to understand the single-session nature of online mental health platforms, we can reduce some of the burden volunteers may feel in trying to have an impact on seeker outcomes such as mood. Thank you.